Delaware está pasando por un mal momento. El condado de Sussex está dentro de los 100 condados más contagiados de los Estados Unidos. Además, 3,503 casos son en Sussex County de los 7,200 casos que hay en el estado. Dice que desafortunadamente se debe a nuestra industria y a la manera en que vivimos. Y claro, de los 216 muertos que hay un 8% que son de la comunidad latina y desafortunadamente está afectando gravemente. Now, Georgetown, Delaware, Seaford, Millsboro, Milford, 4 cities where we have a lot of Latinos living in these areas. We cannot deny something that is obvious in this area. And unfortunately, this is being affected. But what we can do as a community, what we should do in order to not just decline the numbers, but stop this situation, because we've been talking, and sometimes people, I think, it's boring when I'm talking about this, but I don't know what else to do, Dr. Walker.
No, thank you, Kevin. Thank you for getting the word out. And if you're listening today, please tell your neighbors, your friends, your family that it's so important that if you're sick, please get tested for COVID-19. And if you're severely sick, please call your medical doctor right away. You can call the Red, you can call a doctor in the community. Do not wait. We are seeing too many people who should not die from this illness go into the emergency room too late and need serious medical attention, fortunately pass away. And I've heard people arrive so sick that not much could be done. They were unfortunately so sick at home for a long time that they were afraid to call. So we want you to reach out to us for help.
Yeah. Le digo a la doctora que hemos venido hablando con esta cantaleta por más de 8 semanas y que ya no sabemos qué más hacer, pero ¿qué debemos hacer para parar esto? Dice que por favor le digamos a los vecinos, a los compañeros de trabajo, a las personas que usted conoce que tomen esto con seriedad, que no queremos que nadie más muera. Dice que hay personas que están saliendo a trabajar o que están exponiéndose cuando están muy enfermos. Si están enfermos, dice quédese en la casa. Quédese en la casa. Si está enfermo, hay personas que están muy enfermas, que al punto de que por temor o por cualquier cosa no se están haciendo los test, que es importante hacerse el test si usted se siente enfermo, pero hay personas que desafortunadamente están llegando a los hospitales muy tarde, cuando ya no hay nada que hacer. Y dice precisamente que si usted está enfermo, contacte a la red, contacte al médico que usted tiene o algún doctor. Es importante que no se quede enfermo. Es importante que si se siente enfermo, aparte de quedarse en casa, obviamente contacte al sistema médico para poder ser tratado. Now, let's talk a little bit about the people in the hospitals and ICU and obviously, in general, the people in the community being sick. Yesterday, we had the opportunity to talk with Dr. Maria Barrientos. She's from El Salvador, and she's been questioning for weeks now to the CDC, questioning to who, and questioning the procedures and the protocols that is being adopted by the United States especially. She's been saying why people is following what a magazine posted a few weeks ago or weeks ago, Lancet. I'm referring to Lancet magazine, one of the most prestigious magazines in the world. In fact, when I saw that conversation with when I talked to Dr. Barrientos yesterday, she's questioning why we are using just Tylenol, why we are not using something to disinflammatories in order to stop the spread of the virus in the beginning of the illness. What do you will have to say about this statement, Dr. Walker?
I think what's important about that statement is that we are learning a lot about what medical treatments work. And there is one small study that's out there that says not to use ibuprofen. The CDC and WHO have not yet endorsed that study because it is small and based on just a smaller number of patients. What I do know is that if people are sick and they have a fever, they should definitely lower their fever, especially if they're well enough to be home. They're not having shortness of breath or coughing or feeling so sick that they can't move. They should definitely lower their fever. But that's when it's so important to just call your doctor, make sure that they're giving you other treatments that are possible to get you through this if you do get sick.
Are you, the Delaware Department of Health is instructing the people to use just Tylenol, or they have the freedom to treat the symptoms on every patient with freedom, and they cannot be worried about lawsuits or not following the guidance?
So there is no guidance out there nationally, unfortunately, about how to treat COVID-19. That includes how to treat a fever, how to treat the inflammation. The Center for Disease Control, and especially Delaware, has not provided a treatment protocol because so little is known. But we have more work to do, and we are figuring out what works and what works for what patients. Again, I don't want people to get sick because they shouldn't use Tylenol or ibuprofen. And there are some people who should not use certain ones. I'm a family doctor. My patients with kidney disease should not use ibuprofen in normal circumstances, but especially with COVID-19.
Dice la doctora, le estoy preguntando que cuál es la opinión que ella tiene con respecto a la entrevista que tuvimos ayer con la doctora Barrientos, que ella dice que se debería utilizar desinflamatorios, antiinflamatorios, para que no continúe la enfermedad, que se debería tratar los síntomas del paciente, de la persona enferma. Y lo que dice es que, basado en un pequeño estudio, ni el CDC y tampoco la Organización Mundial de la Salud han hecho un endorsement, han adoptado este proceso o han aceptado este statement. Sin embargo, dice que, y le preguntaba que si en el estado de Delaware hay una guía, si es que se le ha dicho a los hospitales, a los doctores qué usar o qué no usar. Dice, lamentablemente no. Dice que no, que en cierta manera hay una libertad que los doctores puedan tratar de la manera que sea, porque no hay una guía, no hay un protocolo que diga cómo tratar el coronavirus. Y lamentablemente, dice ella, por ejemplo, como doctora, dice que los pacientes que tengan problemas de hígado, ella no le recomendaría utilizar ibuprofeno, precisamente porque ellos podrían ser afectados gravemente en condiciones regulares, dice. Sin embargo, que en Delaware en realidad no hay un protocolo. Now, will you consider to review it? Because I'm worried about what the FDA is saying. I saw the FDA publication in regards to the ibuprofen, and FDA is saying it is recommending not to use ibuprofen, even though in the second statement say they haven't proved anything, and when they found some proof, they will publicize. So obviously a lot of people follows what the FDA said. Not just in the United States, but in many countries in Latin America. So obviously, this not having a protocol or guidance obviously confuse a lot of doctors and a lot of people in the practice, don't you think?
Yeah, no, I think you're absolutely right, Kevin. And you're an adopted medical doctor now, but based on your review of these studies, I think what's really important is that we make sure that we're using the best evidence and the best guidance out there to make sure that we know what's safe and what isn't. And the FDA is certainly a important resource, but they make their judgment based on huge studies, large numbers of people, and we don't have that with COVID-19 yet. We're collecting it, but we don't have it.
But don't you think FDA is making a wrong statement saying not to use when they don't have an approved in the second line?
I think that they are cautious and very conservative. And I won't say they're wrong or right because we don't know. And at some point, I hope we do know.
Because a lot of people, sometimes even the doctors, they say, we follow what the FDA is saying because they're supposed to be the organization to prove before they make any statements. You're never going to have the approval of FDA until they do all the studies and everything. But in this case, they're saying we don't suggest to use, but we don't have any proof. So that's what I'm saying that. But anyway, so
exactly. And so that's why they're experimental treatments that the doctors can use, but the guidance isn't clear yet.
So if somebody is sick, will you suggest as a doctor to treat the symptoms? Let's say you have an inflammation. They should use anti-inflammatory products, anti-inflammatory pills in order to avoid the continuous spread of the virus inside of the body during the inflammation time?
Yes, absolutely. And that's what our doctors in our hospitals are doing. Depending on the case and the condition, they're absolutely using medicines to lower the fever, to decrease the inflammation, to make sure that people are recovering. And there are many different kinds of medicines that do that. And so they're using the best treatments. And we do have a high recovery rate, not only in Delaware, but also in this country because of the range of medications we're using,
Fantastic.
including the shipment we just got of remdesivir, which is the antiviral used for Ebola, that we are also now able to use in Delaware.
Ok, esto es muy importante lo que acaba de decir la doctora Walker. Le estoy preguntando respecto a mi conversación ayer con la doctora Barrientos y dice que efectivamente no hay una cura, no hay un protocolo y desafortunadamente el FDA está siendo muy precavido en mencionar que se usa o no se usa, pero lo que dice ella que en Delaware y en los Estados Unidos se está usando muchísimos desinflamatorios, medicina desinflamatoria para poder controlar la enfermedad. Por eso es que hay muchos de los pacientes que se recuperan. El índice o la tasa de recuperación en los Estados Unidos es muy alta, dice, no solamente en Delaware. Además que Delaware, aparte de los hospitales y los doctores están usando desinflamatorios para prevenir que continúe la enfermedad, dice que también acaban de recibir un paquete grande de esta famosa medicina remdesivir, que es una medicina que se usó en algún momento para controlar el ébola y que ahora se va a empezar a utilizar para controlar el contagio, perdón, no el contagio, pero es que la persona enferme con mayor gravedad. Es lo que está pasando. Así que estoy hablando con la secretaria del Departamento de Salud del Estado de Delaware, Dr. Walker. Now, we are expecting phase 1 on June 1st, but as of right now, Rehoboth Beach is going to be open on their own, and the state of Delaware is going to be open the beaches and the pools sometimes next Friday, the 22nd. Although some of the businesses are partially open right now. So what we are expecting in order to continue going to the phase 1?
Right. As Governor Carney says, this is not going to be so much a abrupt start, but it's going to be a gradual phase-in approach with phase 1 being part of an overall strategy to slowly reopen and test what works for whom. As of Friday, the community pools will be open. The beaches will be open. We'll lift the restrictions, but it's not as we used to be. It still means that ice cream shops have to have restrictions in place. The beachgoers have to wear a mask on the boardwalk. They have to maintain 6 feet of distance. Restaurants and bars are still just takeout and delivery. And we're going to enforce this, maybe light touch, not with necessarily police, but a social compact, if you will, that we make sure people are obeying the rules to keep everyone safe.
Dice, le preguntaba a la doctora Walker respecto de lo que va a pasar cuando nos acercamos a la fase 1 de la reapertura del Estado. La doctora dice que sí, que el próximo viernes 22 vamos a estar abriendo las piscinas y las playas y las heladerías se abren hoy, pero que no es como lo acostumbrábamos. Dice que esto es una cosa que paulatinamente, que despacio vamos a ir viendo y siguiendo los protocolos, ¿no? De distanciamiento físico, de 6 pies, de utilizar las mascarillas, en este caso que se obliga en el área, por ejemplo, del boardwalk. Y dice que el gobernador Carney, él está buscando de que mientras se vaya en el proceso, que todos respeten. Obviamente que no van a tratar de usar como la policía para que la gente haga caso, pero sí para decirle a la gente, hey, estos son los protocolos, respetemos. Now, I believe the restriction for the out-staters, the people who's coming from another states, is still in place. If somebody comes to Delaware, it's still in place 14 days in quarantine. This is a true fact, right?
Correct. We are still discouraging people from other states to come to Delaware to enjoy our beaches. We are not encouraging short-term rentals. So this is really trying to limit the number of people and crowds that will come to the beach.
Dice que todavía estamos restringiendo la entrada de personas de otros estados, que todavía las personas no pueden rentar hoteles ni casas acá en el estado, así que lo que se quiere es evitar que haya una cantidad masiva de gente que vayan hacia las playas, dice la doctora Walker. Now, I believe normally, traditionally, you and I and everybody else, when we go to the beach, we're expecting to eat something and maybe have a drink. I believe a lot of restaurants, the Delaware Association of Restaurants, Bars and Restaurants are expecting something new. And I believe you've been working with the task force of Delaware Restaurants Association in order to make new rules. Can we have in advance what will be the new rules?
Well, we're still trying to figure it out, but certainly right now it's still limited to delivery and takeout. As we get further along and have more widespread testing, it will likely be a place where we can limit the number of people inside locations and inside the bars. But again, if you envision it as different than it used to be,
Mhm.
every business will have to figure out how do you maintain that 6 feet different distance between patrons? How do you keep the staff safe? How do you make sure that people aren't touching things over and over again that could infect one another? So there are lots of details that we're working out, but I'm sure we're going to have some very creative approaches to how to make sure we can reopen, but do so safely in the coming weeks and
Okay,
months.
can you say probably the restaurants and bars will be open by the 22nd or maybe the June 1st?
I think that right now we consider them open for business, for curbside and delivery.
Mhm.
Certainly the next phase in June 1st, that target date, we hope that it will mean maybe there's some outdoor seating, maybe they have some limited number of people that are allowed inside, but we're still trying to make sure we keep everyone safe and we allow businesses to operate.
Great. Estoy hablando con la doctora Walker. Dice que con respecto a los negocios, le decía que obviamente las playas, cuando vamos a la playa, queremos disfrutar de un helado, de comer, de tomar un trago, qué sé yo. Y le preguntaba, si yo sé que ellos vienen trabajando muy de cerca con el Task Force de la Asociación de Restauranteros del Estado de Delaware, y le decía que si es que hay algún plan de cómo van a manejar. Dice que posiblemente sí, que están trabajando para dar los mejores resultados, que posiblemente para junio primero va a haber un protocolo diferente para que abran los restaurantes. Por ejemplo, gente va a poder sentarse en la parte de afuera, quizá adentro con limitada cantidad de personas, que todavía no se tienen el día ni la fecha exacta, pero que se está trabajando para eso. Dice que claro, que el junio primero es el goal, es la meta para reabrir parcialmente el Estado y la gran mayoría de negocios. Now, so far, what you've seen, we have another stores open, hair salons and stuff. So far, what do you think is working and what is not working? What needs to be fixed?
We have a lot of work to do. We still need to make sure that more people get tested.
Mm.
And I would say that the testing we did yesterday shows that we can get there. We use this new test that's a saliva test. You spit into the testing unit.
Mhm.
We've done about 600 of those in a 4-hour period in Seaford. And yesterday it was very successful. So we need to do more of that to keep people safe at home and at work. And then that will show us what to do in businesses where we can have more people back to work, more people feeling safe, more people feeling like if they're sick, they can get tested.
How many people were tested yesterday in Millsboro chicken plants?
In the chicken, I don't have the numbers for the poultry plants. We're continuing to make sure that everyone is tested. Although what I can tell you is that the numbers of people who are testing positive and have symptoms is going down.
Okay.
So that's very encouraging.
And today will be another round for the night shift in Millsboro plants as well, right?
Correct.
Ok. Dice la doctora que lo que están haciendo, le digo, ¿qué es lo que se necesita corregir o qué es lo que se debe hacer para seguir con este plan? Y la doctora Walker lo que dice es que se necesita hacer más testeo, más pruebas de COVID-19, que el día de ayer hicieron el test, han hecho en estos días, incluido ayer en Seaford, 600 test con saliva, que dice que es un nuevo test que están probando y que cree que está trayendo fantásticos resultados. Dice que también me confirma que ayer fue en una de las plantas de pollos de Millsboro fue hecho el testeo y que dice que lo que sí están encontrando es que hay menos personas enfermas. O sea, que están viendo que la cantidad de personas enfermas o dando positivo en promedio sí está bajando, menos personas enfermas. Y que hoy van a continuar para del turno de la noche, también en la planta de Millsboro van a seguir haciendo más test. Doctora Walker, I truly want to thank you so much for your time. I know I cannot imagine how hard it's been dealing with all the industry, with all the hospitals and all the community members. But I wanted to hear your message for the Latino community. If you want to use your Spanish, it's fine. If you want to do it in English, it's fine. We can translate. I can do the best I can to translate and bring the message from you as an official from the state of Delaware to the community.
Sure. Eso mismo. No tenga miedo si su doctor le ordena a usted a tomar pruebas médicas. No tenga miedo si su resultado es positivo. nosotros estamos aquí para ayudarle a usted y a su familia. Por favor, la salud de su familia es nuestra mayor prioridad. So, por favor, let us know how to help. Please call Delaware 211. Llama Delaware 211.
211, ese es el número que tienen que llamar. Si usted necesita ayuda, si usted, now, one of the things that I don't want to let go is, a lot of people is asking, you know, and being now working for 8 weeks, 6 weeks, people is getting sick and they don't have food and they don't have probably resources in order to continue facing these bad situations. The state of Delaware still have resources in order to help people with food. I know it's going to be a food pantry next week in the state of Delaware, but calling to 211 is going to be help for the people.
Yes. Please call 211. Please call 211 if you need help figuring out if you're positive and you need a safe place to stay that's away from family members who could get severely ill. Call us if you need help with your rent, your electricity, if you need help with food access. We have options to help you apply for benefits or not. If you don't qualify, please do call us as well. We have donors sending in donations to make sure people can stay safe right now, and we can help you secure those resources.
Dice la doctora Walker que sí, que llamando al 211 ellos van a tratar, siguen recibiendo donaciones, siguen recibiendo ayuda igual, y que usted llame al 211 si tiene alguna necesidad, ellos van a estar ahí para ayudarle. Dr. Walker, thank you so much for your time, and I hope every time we talk to you, it's going to be a better news like is going on right now. Thank you so much.
Thank you.
Thank you. Have a good day. Son 7:27 en la mañana. Más adelante estaremos con más información aquí en Máxima 953.